everybody, and welcome back to my channel. I hope that everyone is staying safe and sound in this pandemic, and I hope that everyone is ready to learn something new today. But first, if you like what you see, give me a big thumbs up. Really helps with the YouTube algorithm. Hit that bell notification so you know my videos come out. Generally between 3 and 4. This is a family-friendly channel, so anyone can watch it. And please do me a favor and subscribe to my channel. Help me and help yourself. I currently have 170 subscribers. I'm trying to reach 200 by the end of the summer. So what I'm doing is I'm going to give a random subscriber who comments, because sometimes I can't see you. You know, a lot of people tell me, hey, I subscribe to your channel. Don't you see me? I said, no, you don't have a public account. I can't see you. But if you comment, then I can see you. So do that, please, and one subscriber will get $20 when I reach 200. Okay. Don't know how long I'm going to be doing YouTube. At the end of the summer, I'm hoping to go back to work, but because of the coronavirus and the Delta variant, I don't know if that's going to happen, but we'll have to wait and see. And speaking of the coronavirus, today is Wellness Wednesday, and I thought that I would focus a little bit on the coronavirus. I know it's a hot topic, but some people, you know, are not sure. Hey, do I have it? Did I have it? I don't know. So I said, well, let me do that today. Okay. So how to treat the symptoms of COVID-19 at home. Okay. So the first thing I need to tell you is I'm not a doctor, nor do I play one on TV. So, you know, you should know whether you have it or not, well, by the symptoms. If you think you have it, I would advise you to get tested. Now, if you don't have severe symptoms, you could stay home and treat it. So that's what I'm talking about. So, a person can treat a mild case of COVID-19 at home, although home treatment will not cure COVID-19. So remember, it does not cure it. It can help relieve the symptoms a person is experiencing. Okay, so notice, all data and statistics are based on publicly available data at the time of publication. So, severe acute respiratory syndrome, coronavirus 2 causes COVID-19. So, in this article, we can look at what to do when a person contacts the virus. We can also discuss how a person can treat the symptoms at home. Okay. So, when to seek emergency help. The Centers for Disease Control and Prevention, CDC, advise that a person seek emergency medical attention if they are showing any of the following signs: difficulty breathing, persistent pressure or pain in the chest, bluish face or lips, which shows that your body is oxygen deficient, new confusion, or inability to stay awake or wake up. It is important that a person calls ahead the local emergency facility to inform them that they are seeking care for someone who may have COVID-19. So, is home treatment effective? The CDC defines a mild illness as having any of the various signs and symptoms of COVID-19. Examples: fever, cough, sore throat, malaise, headache, muscle pain, without, keyword, without shortness of breath, dyspnea, or abnormal chest imaging. So remember, if you have those, you need to go seek help. They also state that a person can treat a mild illness at home. People should also monitor their symptoms to keep a doctor updated. So you should let your doctor know either way. A doctor can instruct the person when to go to the emergency room and what specific home treatments might work best for them. A person who has COVID-19 should also stay home until a doctor clears them from contact with us, meaning don't go anywhere. Avoid other people in the home as much as possible, so isolate yourself. Frequently wash their hands and cover their cough to avoid spreading the disease to others in the house. Wear a mask that covers their nose and mouth when in contact or close quarters with other people. So a lot of people, like when I go out and I wear a mask, sometimes I don't cover my nose. And they're like, well, why aren't you doing it? I'm like, well, I have breathing problems normally with my sinuses, so it's hard for me to cover my nose. But that's what they're telling you. Okay. A number of home treatments may help manage symptoms of COVID-19. So the first step is to find out if you have it or not. I would suggest that if you think you have it, get a COVID-19 test, which is, readily available at many different places. Okay. These treatments do not cure the disease, but they make a person feel more comfortable. A healthcare professional can advise a person on how to treat the symptoms. However, the CDC recommends getting plenty of rest, remaining hydrated, drink a lot of water, taking over-the-counter medications such as acetaminophen. Fever, aches, and pains. A person can take acetaminophen and non-steroidal anti-inflammatory drugs such as ibuprofen, as they can help release fever, and ease muscle aches and pains. A person should also ensure that they drink plenty of fluids to help prevent dehydration. Initially, some people were concerned that ibuprofen might worsen COVID-19. However, there is no scientific evidence to support this claim. Okay. Cough. Coughing is a body's way of trying to clear the airways. The United Kingdom's National Health Service advised that people with a cough avoid lying on their back. Instead, they should sit up or lie on their side. To help ease coughing, a person can try the following. Drinking plenty of water or warm beverages to soothe the throat, prevent dehydration and thin the mucus. Sucking on cough drops or using a humidifier at night. Some people may also find relief by breathing in steam. To do this, they can sit in the shower or on the bathroom floor with a hot shower running. Shortness of breath. The NHS note that feeling breathless can be a sign of a more severe SARS-CoV-2 infection. So if you have shortness of breath, I would say go to the emergency. If a person is feeling breathless, they should try to remain calm. Shortness of breath is a symptom that can be frightening, but panicking can cause hyperventilation, which can make it worse. People experiencing shortness of breath should continue focusing on their breathing. It might also help to keep the room cool. The NHS also suggests doing the following. Slowly inhaling through the nose and exhaling through the mouth, keeping the lips close together. Sitting in a chair with a long, straight spine. Relaxing the shoulders and avoid rounding the upper back. Leaning forward slightly and placing the hands on the knees for support. Some evidence suggests that lying on the stomach might help people get more oxygen. This is because lying on the front of the body can stop the heart and stomach from pressing on the lungs. This then results in the air sacs being able to fully inflate. There are 4 positions a person can try. Position 1, lie in the front of the body with the head turned to one side. Tuck both arms under the chest and shoulders. A person can also use additional pillows under the shins to provide support to the hamstrings. Position 2, lie in the front of the body with the head turned to one side. Turn the arms out and up next to the head. Place a pillow under the belly. Position 3, lie in the front of the body with your head turned to one side and the leg on the same side bent at 90 degrees. Person can support the leg with a pillow or blanket and place the arms wherever they feel most comfortable. Position 4, lie down the side and place a pillow under the torso and knees. Supplements. Okay. It is not clear at the moment whether supplements can improve the outcome of people with COVID-19. There are some studies, but the results are conflicting, so they're not sure. Vitamin D. A 2020 study found that when those who were deficient in vitamin D received a high dose of vitamin D supplementation, a greater population had no detectable SARS-CoV-2. Okay? However, this study was small and there is insufficient data to support using vitamin D to treat or prevent COVID-19. But it can help with vitamin D deficiency. Vitamin C. One 2020 study notes that high doses of intravenous vitamin C lessened the severity of COVID-19 in 50 patients in China. Earlier research, including a 2019 mega-analysis, suggests vitamin C may reduce the length of the time people spend in intensive care unit. So vitamin C is good for you when you have a cold. I know that. So there are ongoing studies to test whether a higher dose of vitamin C can counteract some of the excessive inflammatory responses that healthcare professionals see in those with severe or critical disease. Okay. What not to take. Okay, so what not to take. Not to take any treatment for COVID-19 without the recommendation of a healthcare professional. So always check with a healthcare professional. People have died or experienced serious harm after taking unapproved products to treat COVID-19. One example includes non-pharmaceutical chloroquine phosphate, which is a chemical that people use for home aquariums. Pharmaceutical chloroquine phosphate will not treat COVID-19, and a person should only ever take it under the guidance of a healthcare professional. People should also avoid taking the following to treat COVID-19. So don't take antibiotics. SARS-CoV-2, which causes COVID-19, is a virus, and therefore antibiotics will not treat a coronavirus infection. Sometimes people with COVID-19 develop other infections. Even then, it's important to take the right antibiotic. People should also avoid taking expired antibiotics or antibiotics prescribed to someone else. The FDA states that the expired or old antibiotics may lead to more severe illnesses and antibiotic resistance. Herbal medicines. There is no evidence that herbal remedies can treat COVID-19. These drugs may also interact dangerously with some prescription medication. Prescription drugs. People should not take someone else's prescription drugs, even if a doctor prescribed those drugs to treat COVID-19 in someone else. Only a few prescription drugs and medical products may help with COVID-19, and those are usually only safe for people to have under the supervision of a healthcare professional. Recovery. To further support recovery, a person should drink plenty of fluids and rest as much as possible. The WHO states that people most typically recover 2 to 6 weeks. However, some people may experience long-term effects of COVID-19, also known as COVID or long-haul COVID. Symptoms can include muscle weakness, low-grade fever, extreme fatigue, difficulty sleeping, headaches, lapses in memory, diarrhea, vomiting, loss of taste and smell, sore throat, shortness of breath. Okay. When can you see others? This is important. If a person has been in close contact with someone who has COVID-19, they need to stay at home and self-isolate for 14 days. Not 5 days, not 10 days, 14 days. Okay. The CDC suggests the following time frames before seeing other people. 10 days since their first symptom appear. If they have 24 hours no period without the use of medication to reduce fever and other symptoms of COVID-19 are improving. So in summary, you can treat mild cases of COVID-19 at home. Okay. Again, they said that you should, let a doctor know if you have it or if you think you have it and, get tested for it. Don't just assume that you have it or assume that you don't have it. No, if you think you have it, then you should, obviously you should do something about it. Okay? So that's it for today. Again, if you like what you see, give me a big thumbs up. It really helps with the YouTube algorithm. Hit that bell notification so you know my videos come out. And please, do me and do yourself a favor by subscribing to my channel. And one person will receive $20 when I reach 200 subscribers. Tomorrow I will be doing a video, maybe ESL video, a teaching video. I'm starting that this month in preparation for going back to school, hopefully in September. We don't know about, with the Delta variant, whether it's going to be in person or virtual or hybrid, I don't know. But I'm going to start doing that every Thursday. It's going to be called Teachers Thursday. So I will be doing a lesson every Thursday for you guys. Stay safe, and I will see you tomorrow.